Welcome to RevMD Sex Bites podcast with me, your host, Dr. Deborah Durst, and my co-host.
Hey guys, Verity Golombieski, nurse practitioner here at RevitalyzeMD.
So today we have a great podcast and topic, and it's Botox and ED, or erectile dysfunction.
So this was a fun one.
Mm-hmm.
We both
learned a lot.
Yeah. We had a patient recently ask about getting Botox in the scrotal area or into the penis, and we were like, let's dive into that a little bit.
Well, they're
Why
starting
not?
to talk about it more. It seems to be gaining some traction on social media. Mm-hmm. And so addressing this will be good. So what would make one think that a muscle relaxant, something that paralyzes a muscle, would make an erection harder?
Right? It kind of seems counterproductive at first.
It
that
does.
We would paralyze something for it to work better.
Yeah, or paralyze and make something, stronger and harder. But the penis is not a muscle. That's what it boils down to. So we have muscles in the penis, and what we're targeting is smooth muscle in the penis so that we can get relaxation of the smooth muscle.
So when the smooth muscle relaxes, what happens? We have increased blood flow.
Yeah.
And where the neuromodulator can affect neurotransmitters like norepinephrine, it does not negatively affect nitric oxide. So it then helps
affect some, but not other, hormones or neurotransmitters in the area. Yep. So the big thing is it also kind of helps with that relaxation of blood vessels. And so those receptors on the blood vessels are more responsive too. But then again, it doesn't affect nitric oxide, which helps the blood flow.
And we've done lots of podcasts on that before as well, talking about Cialis, Viagra, nitric oxide. So definitely listen to that to learn a little bit more about how nitric oxide helps erectile dysfunction as well.
And like and subscribe, you'll get notifications on future podcasts, and it helps us grow the channel. So the big thing is that when the penis is flaccid or soft and not being aroused and stimulated, then the smooth muscle in the penis is actually contracted. And so that also, Botox will relax that smooth muscle and blood vessel wall as well. And so you have increased blood flow, but you also have a bigger flaccid or soft penis too. So that is another aspect of it that you may not think about. So you have a bigger erection or a bigger penis when you don't have an erection, and then you have better blood flow for a stronger erection when you have arousal. So, and the other thing is that this is new again, so it made me a little nervous when I first read about it. Do I really want to inject the penis with Botox? Because that's a big, almost like blood vessel. You're thinking about it, it's like a reservoir of blood. And do we want to inject Botox directly into that?
Because it does affect vessel walls. When you relax the vessel wall, what happens? The diameter gets a little bit wider, but then again, it helps with more blood flow.
It's been shown, again, small studies, so not a huge amount of patients that have had this done and studied. So there's limited data at this point. And as we say in medicine, and this has been a big issue over the last couple years with these lack of big randomized controlled multi-center studies, does it really support safety and efficacy? And they say it does, but that's still, there's more needed for sure. But I think it's safe enough. And the fact that we're involved in like the Cellular Medicine Association with all the vampire procedures and the P-shot, O-shot, and that whole provider group, they're all now starting to study it more and standardize the protocols.
And do specialized training.
Yeah.
So now you have a larger provider group getting together. You have more patients that are having the procedure done, and we're just not seeing any of these negative side effects. So, which is great.
Yeah.
Patients are doing well with it.
Yeah.
But again, anytime something's new, we were talking about this before the podcast. You never want to be the first.
You don't want to be the first.
But you never want to be the last either, right?
No. But you can always feel more confident doing it. And it certainly helps me justify my advancing into doing this procedure just based on the fact that I'm in a provider group and we're going to be talking and we're going to be learning as it goes along. And so far, I've not heard any negative effects of it. So that's a good thing.
Especially when we first started looking and we're looking at research of what, 176 male patients total?
Well, I think there were two separate studies. One
Yeah.
was 35 and one was 176,
Yeah.
but like 200 and some patients.
So really not a lot of patients when you talk about the end of the study saying, yeah, this is effective and safe. Typically what we see at the end of those studies is it seems like it's effective and safe, but more studies are needed. But that wasn't stated in this one. It was
safe and effective.
Safe and effective treatment.
176 patients. So that was at the end of that study. Yeah. That's what they stated. But again.
So at first we were very hesitant until we saw CMA and that they were putting together,
standardizing protocols, educating providers on it. And I think that standardization of a protocol in how you're doing it is important, because then you have physicians that are doing it the same way and comparing results and any adverse effects if that happens. But again, it is an in-office procedure that might have just a little bit of pain involvement, but lasts for 3 to 6 months.
Yes.
And so that's a good duration of action. And maximum was 3 months and a 40% improvement in those studies.
Yes.
And then still had effects at 6 months. So that's a good duration. And so cost, I think you were going to go into that a little bit.
When we talk about cost, you got to think about Botox. What does Botox cost, right? Anywhere, depending on where you live, $10 a unit to $13 a unit. And you're looking at 50 to 100 units based on those two studies. Definitely the patients that had 100 units had better prolonged positive side effects from the injections.
Yeah.
So
they basically had better results overall.
Yeah.
So
better blood flow, stronger, harder erections, increased length and girth for some as well, improved self-confidence. And they are a great option for patients who maybe Cialis and Viagra isn't working very well for them. Maybe they've tried Trimix and Trimix isn't working for them very well, or using them in combination with those medicines. So we always like to be very comprehensive here. So talking about supplements to help increase nitric oxide, medications to help with blood flow, and now adding potentially Botox to that arsenal.
No, I think that, again, the offering a very comprehensive, array of services is important. So we do believe in, the P-shot and Gainswave and adding Botox as a potential. And we want erections even when people are undergoing those regenerative procedures. So if you can do a little Botox or Trimix or, the PD-5 inhibitors, that's great. And so I think this is a good, so when you hear don't do it because there's not a lot of studies, I think we're always going to be exploring, as long as we know it's safe, different ways to improve. I think that you'll get the push for studies because it is a large drug company.
Oh, absolutely.
And a new indication for them is not bad. It is off label at this point. And so it's important to know that. But I think that it's easier to get studies than something that's a generic for years and even known to be safe, but studies won't happen because it is no longer beneficial financially for a drug company. So we're going to find out probably sooner rather than later with bigger studies, because it is it's a large company that will support that.
And as we know, pharmaceuticals has the money to back the studies and
so,
to push them.
Oh, absolutely.
But I think it's also really important to note that we do use neuromodulator off-label for
almost everything.
Yeah. So hearing, it's not FDA approved and it is off-label, that shouldn't scare you away necessarily. Definitely do your research. Go to somebody you trust, someone hopefully who is certified, has been trained. When we talk about cost, those were very generic prices for Botox or neuromodulator. When we start looking into this, this is additional training and then finding someone, right? We have injectors here who are not going to do this procedure. It is just not something they're going to be comfortable doing. So finding a provider will be potentially a challenge
Yeah.
because it is newer. And then finding one that's certified or has had training or is part of a group that is part of these trainings, I think is really important.
And standardizing them. But yeah, no. So I think that a lot of people are not going to inject into the penis, even if they've been injecting Botox into your face for a long time.
Yes.
And so just accept that, so you're going to have to find a provider that is definitely well educated in male, health and male sexual health. And so that's necessary. The off-label uses, yes, a lot of things that we do as far as the face are off-label, but also the units, the 50 or 100 is a pretty standard for a cosmetic injecting, unit amount. But it's even a little bit less than you would use for skeletal or headaches and migraines. So it's definitely within a range that's acceptable. The price range is going to be pretty standard or a little higher, like Faraday said, because you're going to have a hard time finding somebody to inject into the penis. Quite a bit different and
Yes.
can be scary if you're not doing that on a regular basis, which we are. So it's interesting though, because all along we've talked about Botox, like when somebody comes in for Botox and they're getting
Yep.
it, just to beautify. So that's what we consider Botox. And then there's Scrotox,
Yes.
which is scrotal, can be used for pain and Botox in the scrotum or even, just beautifying
Yeah.
the scrotum.
De-wrinkling.
De-wrinkling.
Relaxing.
Yeah. And I think that's kind of how this came to be. And then
Yeah.
we're going to do another podcast. So follow along again, like, subscribe, share with friends, and please leave comments, questions, concerns, or fears. Because I'm sure that some guys are going to say a toxin in my
Yeah.
penis.
What?
No way. But then again, men will say yes to better erection. So we'll see. We'll see, guys.
Hey, if you've had this procedure done, let us know. I'd love to hear from you.
Yeah, no, we would love it. And then, so what we're going to do Botox or a podcast on next is Bocox. So find out what that is all about. So we had Botox, we had Scrotox, and now you're going to learn about Bocox. So like, subscribe, share with friends, and let us know anything else that you would like us to cover, because we're here to deep dive into anything sexual wellness, and let us know. Thank you.
Thank you.